Welcome! You're watching We Heart Therapy, and this is a special series, Your Guide to Therapy and Coaching. I'm your host, Anabelle Bugatti. Today we're talking about binge eating disorders and how that can be addressed in therapy. We have a special guest, Jenny Stepp. She's a licensed professional counselor, or LPC, here in Las Vegas, Nevada, and she's agreed to come on our series today and talk to us about this special topic. Thank you so much for being with us today.
Thanks for having me.
So can you talk to our viewers a little bit about binge eating disorder and how it's sort of different than other eating disorders?
Absolutely. That's a great question. Binge eating disorder is a pattern of eating in which a person eats a large quantity of food in typically a short period of time, what we call a binge. And it can involve eating in secret or in hiding behavior, not wanting other people to see this pattern, and sometimes eating when a person's not even hungry or definitely past the point of fullness. It usually involves a tremendous amount of shame and guilt. It causes people a lot of distress, and it's feeling like you're out of control and unable to stop or manage the behavior. Some other terms that we've used to understand binge eating disorder: compulsive overeating or emotional eating, comfort eating, binging. And binge eating disorder is now starting to be talked about in conjunction with food addiction. Just as a person can be addicted to a substance like alcohol or, say, sugar, or a behavior like gambling or eating, a person can be addicted to food. And anytime that we use food to numb or alter the way that we feel, and we're out of control, and that even if there could be serious consequences, health consequences or relationship consequences, then we're really talking about something that's like an addiction. Binge eating disorder is different from other types of eating disorders such as anorexia or bulimia in that it doesn't routinely involve compensating with extreme measures such as purging or extreme calorie restriction after a binge.
And when we mean purging, some of the ways that people purge might be throwing up or using laxatives. So binge eating disorder doesn't use any types of measures to make sure that you maintain a low body weight. It's more, like you said, more of an addiction. It sounds like people sort of self-medicate with food.
Yes, and I really want to stress that binge eating disorder really isn't about food. It is about trying to manage or comfort or deal with underlying stressors in a person's life. So another way to think about it is kind of an unhealthy coping strategy for dealing with pain. So pain management with unhealthy methods.
So people that might be emotional eaters, when they're sad and depressed, you find them going to the tub of ice cream.
Yes.
You know, but like you said, oftentimes it's done in secret, and there's a lot of shame about what they're doing to sort of cope with what's happening for them.
Yes.
So can you also talk about, you mentioned that, oftentimes, they're using it to self-medicate for stress and emotional comfort, whatever, but I know often in the therapy field when we talk about eating disorders, there's a lot of other maybe emotional disorders that might accompany, or mood disorders. Can you talk about what other type of problems or disorders might accompany binge eating disorder?
Absolutely. That's a great question. It's pretty rare for someone to come into counseling with the full understanding that they're suffering from binge eating disorder. So it's pretty common then to see people coming in, they're trying to deal with depression or anxiety or low self-esteem or social anxiety, maybe other impulsive issues or even addictions. This is how binge eating gets really masked and can go unnoticed and really hasn't been dealt with in a person's life. So with that, I would say if you are in counseling, make sure that you talk about your eating patterns and food behaviors with your therapist, because you really could dive into some other underlying issues. Furthermore, it's not uncommon for a person who's dealing with food addiction or binge eating disorder to have suffered some kind of trauma in their personal or family life, maybe physical abuse or sexual abuse. And so therapy really does involve getting underneath some of these other issues and looking more deeply into
Right.
the other behaviors.
Right. I think that's so important that you mentioned that some people who suffer from binge eating disorder often have experienced some type of trauma in their life. And I know I myself have had clients who have come in that have struggled with weight issues and had binge eating disorder, and part of their protection against other people is I want to keep people away so that I'm safe, so that nobody violates the boundaries that were violated when I was younger. And then eventually in their adult life they get to a point where they realize they're lonely and something's going wrong, but they don't know how to stop. Right?
Yes, exactly. Yes.
So if somebody wants to find treatment for binge eating disorder, what would they expect treatment to look like?
Yeah, that's a great question, because I think there has been so much shame and there have been so many negative stereotypes, and that this issue hasn't really been addressed until more recently. So a lot of people have kind of hidden in the shadows because there have been misconceptions and really negative stereotypes about people. We now recognize, though, that binge eating disorder is a real issue, and it seriously affects people's lives and their well-being and their families. So there are a growing number of great treatment centers, inpatient and outpatient treatment around the country, and therapists who work with everyday people coping with this disorder. I think for us to be the most effective in treatment, we really need to look at treating a person holistically, mind, body, and spirit. And I do that in 3 ways when a client comes to see me. First of all, if we've identified this as a potential issue, we immediately start some education, worksheets and videos and handouts to start talking about basic brain functioning, how sugar affects us, how lack of sleep affects us. We talk about physical health and well-being. We do some basic nutrition education and healthy movement and exercise education. We also talk about developing healthy self-esteem and understanding our family systems and environment. So much is revealed in that educational process. The second piece is individual therapy. This is where you really dive in with your individual therapist, and that relationship is very important. We'll talk about some resources for connecting with a good therapist, but this is where you dive into your own personal life. You're really dealing with family history, personal history, any mental health issues that could be going on. We're working on increasing self-esteem. We're working on understanding your patterns, developing healthy boundaries with yourself and with others. So this is the intense individual work. And then the third component that's necessary for effective treatment is a group and a support component. Coming out of the shadows and connecting with other people who understand your struggles. And it's really wonderful when people get to sit with others who have struggled with this and see, oh, I'm not alone, that there are other people who get this and get what I'm saying. There are some great support groups around the country. There are 12-step recovery groups. There's Overeaters Anonymous, something we call Celebrate Recovery. There are groups offered in churches and community centers. There are also weekend retreats available where people get to go away with a group of people and have some education and quality time with other people. The important thing, though, is to connect with others. So those 3 things: education, individual therapy, and support group. Those components seem to be the most effective for treating this issue.
And would you say that's your go-to method when somebody comes in?
Absolutely. Absolutely. I want to make sure that we're plugged in those 3 areas.
Perfect. So if somebody isn't in Las Vegas, if they're in another part of the country or another part of the world, what would be a good way for them to find a therapist that treats binge eating disorder?
Yeah, I would say go online. This is a great time to utilize the internet. The 2 resources that I use are National Eating Disorders Association.org. So it's www.nationaleatingdisorders.org. And they have a great search tool for support groups and therapy. And then they also have a neat helpline that you can call and speak with someone live in real time, or a chat session where you can talk to someone over the internet to get connected with some support. And then the other resource that I recommend is psychologytoday.com. It's a great way to find therapists in your area. So you go to the website, you type in your city, your location, and you'll get a list of therapists, and you can read their profiles, and you can narrow down by specialty, by insurance type. You can read about them, and then click to email or call them. And I would say set up a few consultations, talk to a few different people. Some people you'll connect with right away, some people maybe just isn't the right fit, and that's okay. Keep reaching out until you find that person that you could do some deep work with. So those are my two favorite resources.
Excellent. Now, if somebody is in Las Vegas and they'd like to work with you, how can they find you?
You can also find me online. My website is www.lvcounselor.com. You can go online, check me out, read about me, and then you can either call or email me. We'll set up a complimentary phone consultation, talk about what's going on, see if we might be a fit for one another. I have a private practice in Summerlin, and I specialize in individual therapy. And reach out. Something I really want to stress is that you don't have to take this journey alone. It can be a hard, lonely road, and there are great people out there. There are great therapists. There are great people in the community that are willing and able to connect and offer their support.
Excellent. So www.lvcounselor.com. Jenny Stepp is here in Las Vegas, Nevada, in the Summerlin area. And like you said, very importantly, if from the information you've seen in this video, you can identify that you might be struggling with binge eating disorder, please reach out to a skilled therapist in your area. Don't suffer in silence, and don't suffer through this alone. There is help. There are options and resources for you. Thank you again so much for being a part of our series. We really appreciate it. Thank you again to our viewers for tuning in, and make sure that you hit subscribe at the end of this video so that you can stay tuned, because more videos are on the way.